شكرا أستاذ. I'm Dr. Kajan Hamali. I'm glad to share with you this discussion about the pharynx and its related space. In my opinion, it's somewhat difficult, but I hope inshallah will be easier after this presentation.
جازان الصوت راح ماكو.
Extending from أكو صوت أستاذ؟
إيه هسه رجع. جت فترة انقطع هسه رجع. أوكي.
The pharynx is a muscular tube extending from the skull base to the cricoid cartilage approximately at the level of the C6 and where it is continuous with the esophagus. It lies behind and communicates with either nasal cavity, oral cavity, and the larynx, and divided accordingly to the nasopharynx, oropharynx, and the laryngopharynx, providing a common entrance to the respiratory and GI tracts. Posteriorly, it lies on the upper cervical vertebra and their prevertebral muscles. About the anatomy of the pharynx, the wall consists of 4 layers. The innermost is a mucous membrane, which is continuous with the mucous membrane of the nasal and oral cavity. And then pharyngeal aponeurosis or pharyngobasilar fascia, then the muscular layer, then the buccopharyngeal fascia, the outermost, and the muscle layer is sandwiched between these 2 fascia. As we said, we have 2 fascia, the thick pharyngobasilar fascia inside and the thin buccopharyngeal fascia outside. These fascias reinforcing the pharyngeal wall and giving rise to its shape. About the muscles of the pharynx, we have 3 circular and 3 longitudinal muscles. 3 circular superior, middle, and inferior constrictors propelling the bolus of food down into the esophagus, and 3 longitudinal muscles like stylopharyngeus, salpingopharyngeus, palatopharyngeus elevate the larynx and pharynx during swallowing. Starting with the superior constrictor muscle, which arising from the medial pterygoid plate to the inner side of the mandible. It is lower part reaching the vocal cords. About the middle constrictor, it is overlapping the superior constrictor and reaching also to the vocal cords, and the inferior constrictor muscle has 2 parts, thyropharyngeus and cricopharyngeus. The thyropharyngeus are attached to the thyroid cartilage and overlapping the middle constrictor, while the cricopharyngeus attached to the cricoid cartilage and continues with the other side. If there was a gap between these 2 or longitudinal or horizontal fibers of the inferior constrictor, giving rise to the weakness point, which is called Killian dehiscence, and the pharyngeal pouch may develop from it. And about the longitudinal muscles, either tensa villi and levator villi palatini, which arises from the medial, arises from the skull base to the soft palate and elevating the soft palate against the nasopharynx and separating it from the oropharynx during deglutition. First, we start with the first part, which is the nasopharynx, represents the most superior portion of the pharynx, bounded by superiorly by skull base and inferiorly by the soft palate. The nasopharynx connects the nasal cavity to the oropharynx and contains eustachian tube opening and adenoid superiorly. If you are going to the details about the boundary, anteriorly there is posterior narines and posterior margins of the nasal septum, as there is in the picture, and inferiorly there is soft palate. Superiorly, as we said, there is skull base, which is sphenoid bone or occiput bone or clevis, the roof of the nasopharynx called vault of the pharynx with the mucosa firmly attached to the sphenoid and pharyngobasilar fascia. Posteriorly, there is C1 and C2 vertebra. Laterally, there is opening of the Eustachian tube located in the center of the lateral wall. And lymphoid tissue aggregates, also known tubal tonsil, occur around the opening of the Eustachian tube. And the fossa of Rosenmüller lies between the posterior margin of the Eustachian tube and posterior margin of the nasopharynx, which I will show you their pictures, inshallah, later. And this diagram showing the sagittal section of the pharynx, starting from the above sphenoid sinus, middle, inferior turbinate, and this is the pharyngeal torsion or adenoid. It is an opening of the Eustachian tube centrally on each side laterally, and below hard palate, soft palate, palatine tonsils, intrinsic muscle of the tongues, mylohyoid, which starting from the mandible to the hyoid bone, and starting from the below, it's cricoid cartilage and the membrane between them known as cricothyroid membrane, then thyroid cartilage and the ligament, thyrohyoid ligament, then base of the epiglottis, and this rest is called valliculum. As we say, the posterior margin of the nasopharynx, there is C1 and C2 vertebra, cervical vertebra. And from the above, nasopharynx, oropharynx, and the laryngopharynx. Also, there is a fold, which is called a epiglottic fold in the trachea. The below one is true cord, and the above one is false cord, and between vestibules. This plain lateral cervical X-ray showing soft palate and the nasopharynx, oropharynx, ankle of mandible, base of the tongue. Also, this is epiglottis, a hyoid bone, epiglottic vallicula, and the ventricle of the larynx, also anteriorly trachea and posteriorly esophagus. This diagram showing the axial section of the nasopharynx, which starting from the anteriorly on each side maxillary sinus, then on the laterally masseter muscle, lateral pterygoid muscle, cancer villi palatini and levator villi palatinum, coronoid and condylar process of the mandible, and this space called parapharyngeal space, which I will talk about it later. And posteriorly, there is carotid sheath, which contains internal carotid artery and jugular vein. And we have clevis bone here. Anterior to it is prevertebral muscles. Then moving to the boundary of the nasopharynx, that notch called torus tuberous. Anterior to it is opening of the Eustachian tube, and which I will show you later in the pictures. Here, this is an Eustachian tube opening, which is located anterior to the torus tuberous, and the Rosenmüller fossa, which is located posterior to the posterior margin of the nasopharynx and Eustachian tube. Also, an axial section of CT showing the muscles of mastication, which is masseter muscle, temporalis muscle, and pterygoid bone, lateral pterygoid plate, and lateral pterygoid muscle, and medial pterygoid muscle, which is connected to the medial pterygoid plate. Also, here we have a parotid gland, its deep part, and also there is tensor villi and levator villi palatini, and posteriorly there is lateral pharyngeal recess or fossa of Rosenmüller, anteriorly torus tuberous, and posterior margin of the nasopharynx. Also, there is an axial section of CT scan showing the muscles of the nasopharynx. This area is nasopharynx, and posterior to it is prevertebral muscles, and this is lateral pharyngeal rectus, which we talked about it previously, and anterior to it torus tubarius, anterior to it also there is an opening of the Eustachian tube and cartilaginous part of the Eustachian tube. This is pterygoid bone, and medially medial pterygoid plate, medial pterygoid muscle, lateral pterygoid plate, lateral pterygoid muscle, and this, the hypodense area is what's called parapharyngeal spaces, which is located anterior to the styloid process and its musculature, and posteriorly we have carotid space, which contains internal carotid artery and jugular vein. Also, there is a deep part of the parotid gland and ramus of mandible, coronoid process, condylar process of the mandible. Also, this dark area or hypodense area is called infratemporal fossa, which we will talk about it later, and the maxillary sinus on each side, nasal septum, nasal bone, and this polyp found incidentally. About the parapharyngeal fossa, this yellow area, also known as prestyloid parapharyngeal space, because it's located anterior to the styloid process and its muscle. It's a deep compartment of the head and neck, now around which most other suprahyoid facial spaces are arranged. It consists largely of fat, neurovascular structure, and in some definition, the retromandibular area of deep lobe of the parotid gland. Sometimes contains part of the parotid gland in the space. And posteriorly, we have carotid sheath, as we said, contain carotid artery and jugular vein. The content of the parapharyngeal space mostly content of fat, then ascending pharyngeal internal maxillary artery and pharyngeal vein, and branch of mandibular nerve. Moving to the infratemporal space, this area, which is a complex space of the face that lies posterolateral to the maxillary sinus, and many important nerves and vessels transverse it. It lies below the skull base and between the pharyngeal side wall and ramus of mandible, reaching the hyoid bone, and the roof passed by foramen of ovale and the smaller posterior one, foramen of spinosum. If you are going to the detail of it, subdivided to masticator space and the parotid space posteriorly. The masticator space, of course, contains muscle of mastication, either masseter muscle, temporalis muscle, lateral pterygoid, medial pterygoid, and also ramus bone of mandible. Mandibular nerve branches and fat also posteriorly. And about the parotid space, contains parotid gland, of course, and external carotid artery, retromandibular vein, facial nerve, and sometimes lymph nodes. This is a masseter muscle and lateral pterygoid with medial pterygoid plate in coronal section. About the pterygopalatine fossa, less commonly known as Phenopalatine Fossa, is a small but complex space of the deep face in the shape of inverted pyramid. This green area is called pterygopalatine fossa, and between the maxillary bone anteriorly and pterygoid process posteriorly, and orbital apex superiorly. Its importance lies as a neurovascular crossroad of nasal cavity medially and masticator space laterally, orbit through the inferior orbital fossa and oral cavity, inferior orbital fissure and oral cavity, and middle cranial fossa through the foramen rotundum. It's important as connects several spaces and facilitates pathology between them. This is a pterygopalatine space which contains the maxillary branch of the trigeminal nerve, sphenopalatine ganglion, also a pterygopalatine branch of maxillary artery. As we said, is connected to the middle cranial fossa through the foramen rotundum. Here we have foramen rotundum. Lateral to us is the Vidian canal and sphenoid fossa, and connected to the orbit through the inferior orbital fissure. This is a summary of what we talked about in diagram. Here, as we said, masticator space of infratemporal and the parotid space. This area is a lateral parapharyngeal space, and the carotid space, and the prevertebral space, and also the posterior vertebral space or paraspinal space. Then moving to the oropharynx, which forms that part of pharynx being the continuation of the oral cavity, and anteriorly in nasopharynx superiorly, and the larynx and hypopharynx inferiorly. It also forms a part of the respiratory tract and gastrointestinal tract. Its boundary, vertical plane defined by circumflex papillae and tonsillar. Part of the hard palate also and soft palate contribute to it. And the posterior part is formed by posterior pharyngeal wall, and inferior part by tip of epiglottis, and laterally each side palatine tonsils presence. Then laryngopharynx or hypopharynx, which forms the most inferior portion of the pharynx, being the continuation of the oropharynx superiorly and both larynx and esophagus inferiorly. It also forms the upper respiratory tract and gastrointestinal tract. Boundaries anteriorly post-cricoid muscle, posterior cricoarytenoid muscle, and posteriorly mucosal wall, middle and inferior constrictor muscle, superiorly hyoid bone, glossoepiglottic and pharyngoepiglottic folds, and inferiorly cricoid cartilage or cricopharyngeus muscle. This lateral radiograph of the neck showing the pharynx and larynx. Starting from the above, here we have nasopharynx, then soft palate, oropharynx, laryngopharynx, hyoid bone, and epiglottis, and arepiglottic fold, and laryngeal ventricle, trachea, and prevertebral spaces. Also, we have a barium soul study of the pharynx and larynx. The upper part of the laryngopharynx molded around the proximal part of the larynx, forming two deep recesses known as piriform fossa. These are the piriform sinuses or fossa and valliculum. If there was a little bit of the contrast, has okay, but the too much filling of these reserves given the risk of aspiration. Sagittal section of this MRI showing middle turbinate, infinite turbinate, soft palate, hard palate, intrinsic muscle of the tongue, genoglossus, mylohyoid, which starting from the mandible to the hyoid bone, epiglottis, vocal cords, thyroid cartilage, cricoid cartilage, and above 2.8 is arytenoid cartilage, corniculoid cartilage, nasopharynx, oropharynx, and laryngopharynx. And I would like to show you some picture of some pathology just to inform you how these nice spaces are distorted by carcinoma, which may invade the facial bones anteriorly and the cranial fossa superiorly. As in the nasopharyngeal carcinoma, which may invade the facial bone and go into the intracranial fossa through the many forames which we talked about it. So both axial section and coronal section is required to evaluate carcinoma. Here we have nasopharyngeal lymphoma, this dark area or hypodense area, and here we have Thornwald cyst, which is a mucus retention cyst, occurs in the midline of the nasopharynx, low in T1 and high in T2. This is enlarged tonsils or tonsillitis. This is oropharyngeal carcinoma. And thank you, all of you, especially our teacher, for your time and support.
عايشة تيدك دكتورة غازان حقيقة بسطتي للفارنكس والنيزوفارنكس وصور واضحة وبرزنتيشن واضح، ولو كنت شوية سريع أنت بس جيد جدا، عاشت يدك. أكو أحد عنده سؤال إضافة دكتورة غازان؟ ماكو. إذا نروح للكويز تايم، نختار محمد مهدي.
نعم أستاذ.
أنت قولي يا رقم حتى هو إذا تقدرين أشري عليه دكتورة غازان.
ماشي دكتور. first one.
أشري إذا تقدرين
واحد صوت بليت.
This is the sound. نور محمد جواد.
second.
adenoids.
These are the adenoids. نروح على سالي عبد الرضا.
نعم أستاذ. 3 medial turbinate.
This is the middle turbinate. مو medial. عندنا superior وmiddle وinferior، مو صحيح؟
نعم أستاذ.
الميدل. الميديال واحد أحمد خليل.
نعم أستاذ. number 4 inferior turbinate.
inferior turbinate. اوكي. عقيل عرب number 5.
نعم أستاذ. hard palate.
This is the hard palate. Excellent. دكتورة مريم.
نعم دكتور.
number 6.
Number 6, intrinsic muscle of the tongue.
Excellent. This is the intrinsic. دعاء على number 7. دعاء.
Genioglossus muscle.
Genioglossus muscle. number 8. نروح على حيدر كريم.
نعم أستاذ. number 8, this is the mandible.
Which part?
The inferior part دكتور.
Which part of the mandible? يعني إذا collision هنا تكتب in the mandible لو تحدد بالضبط. هذا mid sagittal section.
lower part the angle of the mandible.
لا هاي مو الانجل، هاي البادي، مو صحيح؟
صح دكتور. اي صحيح.
اللي هنا هو السيمفيزمنتي الصير بالمد لاين، صحيح لو مو صحيح؟
اي نعم.
رقم 9 هبة.
نعم أستاذ. رقم 9 المايلوهايود muscle.
مايلوهايود. أستاذ محمد تكمل. أستاذ محمد.
عين أستاذ رعد.
وصلنا رقم 10.
رقم 10 لارا نصير.
hyoid bone.
hyoid bone. رقم 11 شيماء.
نعم أستاذ. epiglottis.
epiglottis. عمر فهمي رقم 12.
نعم أستاذ. لارنكس.
علي حسين.
نعم أستاذ.
هذا فوكال كورد مو لا يعني الفوكال كورد كان.
نعم أستاذ بس ما واضحة.
علي حسين.
نعم أستاذ.
13.
هذا ثايرويد كارتريج.
زهراء صباح 14.
نعم Nasopharynx.
صفا.
نعم أستاذ. الأوروفارينكس.
رنين.
نعم أستاذ. 16 corniculate cartilage.
17 نور بابا.
ريتينويد كارتج.
زين آخر واحد نور قاطع.
نعم أستاذ ريكويد كارتج.